Jamie, we've heard that children with acute pancreatitis can have complications. Is there ever a role for surgery in taking care of these patients?
So that's a very important question and consideration, Mark. Patients that have severe complications of their acute pancreatitis, such as the development of necrosis or areas of the pancreas that are no longer alive, patients that have complex fluid collections that mature and cause local problems or local complications, pushing on other structures. In those scenarios, we do consider not just surgical options, but other options, such as an interventional radiology approach, whereby needles can be placed into a fluid collection to drain that collection. Endoscopic approaches can also be considered, where a gastroenterologist specialized in therapeutic endoscopy places that scope down into the stomach and into the small bowel and can thereby drain fluid collections, but also can manage areas of necrosis, non-viable or not living areas anymore that can become infected. So in the context of severe complications of acute pancreatitis, we do consider a whole cadre of options: interventional, endoscopic, and then also surgical. Fortunately, in this day and age, the need for an open necrosectomy, as it has been called, or removal of portions of dead pancreas, is really less likely to be needed because of some of these more novel therapies from an endoscopic approach.
Okay, so it sounds like there's a real team approach to taking care of these patients, and the family should expect to see a variety of physicians.
Absolutely true. So certainly there are critical care physicians, since these patients are typically in the intensive care unit. There are GI physicians, there are surgeons, there are interventional radiologists, and everyone comes together and considers imaging, considers the clinical course of that patient before making any specific recommendations, so that we're really treating each patient very individualized.